cheek picked the title, Will COVID Save the World? I think it's important for us to understand that while we are definitely going to have some major organizational difficulties over the next several months, it's just going to be hard to do lots of things. This is also creating an extraordinary teaching moment for us on the nuclear weapons issue. We are going to get through this epidemic. It's going to be quite terrible in many places. And it's already, caused an enormous toll internationally and here in the United States. And I think that's going to unfortunately get much worse. But we will get through this. And so the point for those of us who have been thinking about other threats to human survival is, can we use this moment? How can we use this moment to keep even more terrible things from happening in the future? And the point is that the president said that this epidemic crept up on us or snuck up on us. I don't remember the exact phrase he used. It didn't. We've been warned about this for decades. I mean, I was doing a little bit of research for an op-ed piece that I wrote last week. Back in 1989, Joshua Lederberger, the Nobel laureate, convened a meeting about emerging epidemic threats. In 1992, the Institute of Medicine issued a whole report on the fact that we would be facing new pandemics, like the 1918 worldwide flu outbreak, and that we needed to prepare for them. And nobody listened to the experts when they said that the sky was going to fall if we didn't take action. And so now the sky is falling, and terrible things are happening. We can't prevent epidemic diseases from emerging, but we can prepare for them, and we didn't. The US is not unique in that situation. The incredibly inept response of the Trump administration cannot be glossed over. It was catastrophic. It is causing an enormously increased toll and will in coming months. But even setting that aside, the United States wasn't prepared for this. We had a small task force in the CDC and in the Homeland Security Department, both of which Trump disbanded. But even had they been in place, they were completely inadequate to the task that we are facing now. There was no serious planning for this totally predictable disaster that the scientific and medical experts were telling us for decades would happen at some point. So going forward, can we learn from that? Can we come to understand as a society that when the scientific community identifies a catastrophic threat and says that the sky is going to fall if we don't take action, we better take action or the sky is really going to fall. And that lesson, I think, applies to future epidemics. This is not the only pandemic that we will see. We don't know when the next virus will emerge, but we do know that that will happen. It does always. It's a fundamental fact of biology that new threats of this sort are always emerging. Will we be prepared better for the next pandemic? And I think one thing that we should note is, as horrible as this is, and it's kind of odd to say this in the middle of this terrible disaster, it could have been much worse. The transmission rate could have been higher, like measles. The fatality rate could have been higher, like Ebola. Could have been some combination of the two. The next epidemic may be even worse than this one. And so we really better take the lesson from this seriously in that regard and be better prepared with a better public health structure, with in-place supplies of material that the medical community needs to fight an epidemic like this, and with a much better plan for organizing the country to deal with a crisis like this, and for other countries similarly to prepare themselves. But beyond the threat of another pandemic, this obviously has enormous implications for our work on nuclear weapons, and also for work on the climate crisis. Because with both of these two existential threats, it's a similar pattern. The experts have been telling us for decades that if we don't make major changes, if we don't do something, terrible, terrible things are going to happen. And in the case of both the climate crisis and the danger of nuclear war, those things are going to be orders and orders of magnitude worse than this terrible disaster that we're living through today. And so I think that we will be in a position to make this case very strongly. It's going to be difficult right now in the short term because people are so consumed with dealing with the immediate crisis. But as this passes, and it will, there's going to be an extraordinary opportunity for us to go forward with a message that we need to learn from what just happened. The experts are telling us if nuclear weapons are not eliminated, they're going to be used. and then to describe to people what that disaster is going to look like, and more importantly, the steps which we know about that we can take to prevent that from happening. So it will be important to put into perspective for people the basic facts about nuclear war. And I suspect these are well known to most of you, and I'm not going to dwell on this at any significant length, but just to hit on the high points of what our message needs to be. A nuclear war, even a limited one, that took place, for example, between India and Pakistan, would not only kill, by the news data that we have available, up to 100 million people in the first week. We've had about, I think the total death toll worldwide from COVID so far is about 15,000. 100 million people in the first week. But it would totally destroy the global economy, have horrible impacts on food production across the planet that would put at least 2 billion people at risk of starvation and end modern civilization as we know it. And again, it's always hard for people to grasp this kind of threat given our daily lives. But it may be a little bit easier for people to understand this in the aftermath of this epidemic. I mean, it's still kind of hard as I go about on my way into work at my clinic and drive through the streets of Springfield. People are out on the street. Many of them are acting as though nothing really is going on. But there aren't nearly as many people as there are normally. Many people are taking this seriously and are understanding how dangerous the situation is. And so our job will be to help them understand how incredibly more dangerous the nuclear threat is. The flip side of this is that we do have a plan, not just to prepare for nuclear war, which of course we can't do, but to actually prevent it. We can't stop epidemic diseases from emerging. We can get rid of nuclear weapons. And we have an opportunity to help people understand that that is the only thing that we can do to reduce the danger of nuclear war to zero, which is where it needs to be. Because today, after a period when we thought the nuclear danger had gone away completely in the 1990s, we now confront a reality where the experts tell us that the danger of nuclear war is even greater than during the Cold War. And we need to listen to those experts as a society, as a country, as a world. Here in the United States, the answer, I believe, to the situation is the Back from the Brink campaign, which has really struck a very responsive chord in people all across the country and offers a very specific concrete blueprint for how we can avoid this disaster. It sets forward a simple platform of activity, 5 planks, that will lessen the danger of nuclear war over the coming years while we complete the 5th plank of the platform, the negotiations to completely eliminate these weapons. And we know how to do that. We've disbanded tens of thousands of them in the past, dismantled them. All we need to do is create the political will to dismantle the remaining 14,000, and we can get to zero. And this whole incredible existential threat can be removed from our lives and the lives of our children. So the challenge, I think, at the moment is figuring out how we move the Back from the Brink campaign forward during the next few months so that we don't lose the initiative that is developed. I think the last time I looked, there were over 350 organizations around the country that have signed on to the campaign. And legislation has passed a number of state legislatures, many city councils, and was pending in many more. Much of that activity is being interrupted, just as this week's speaking tour in New York has been interrupted by the realities of people having to stay home. Our work tends to take place when people come together, and we're just learning how to come together in fora like this electronically. But there's going to be a bit of a learning curve to figure out how to do this. And we're also going to have to be working to get people's attention because they are so consumed with the current crisis. So that's a question that I'm going to be posing. I think that's what we need to talk about today. How can we keep the momentum going? What can we do to bring this campaign through the current crisis in a vibrant form so that we can take real advantage of the moment that will arrive, hopefully within a few months, certainly by later this year, when people are able to sort of stop and pause and look back and reflect on what this crisis means and what the lessons are going forward. Um, there are other things I can talk about the, the issues related, the data that we have recently generated about nuclear war, and I can bring that up later. But why don't we move into sort of a discussion mode at this point about the thoughts that people have of how to basically sustain this movement. How can we use a forum like this? Many of the people on this call are members of groups which have already endorsed Back from the Brink. There are some, I believe, groups on the call that have not yet, and I hope that they will soon. But how can we all reach out to people who are not already on board and get them even now to be starting to talk about this? That's the question.